Hello students, today we are discussing about brief therapy. You know about various therapies which we use in the treatment of psychological disorders or mental illness or any other form of behavioral and psychological problems. The moment I ask you what are the therapies that you are aware of, I think immediately you would be saying about psychoanalytic therapy, behavior therapy, humanistic therapy, gestalt therapy and the rest of it. But today we are discussing one new form of therapy. Before trying to understand this, let us slightly go back to understand the concept of therapy and how the emergence of the therapies have turned up. You are aware that about the psychological illnesses, the understanding of the illnesses and the treatment procedures that were available can be traced back to the antiquity. Especially all these things, how they have happened, how they were comprehended in the ancient Greece, and later on some of the reforms during the medieval ages and later on the Renaissance period, what were the changes that were brought up. All these things I think as students of psychology you are aware. Suppose like if we just think over, were there any scattered references related to talking as a form of therapy exist in our treatment procedures? There are certain occasions where the research has quoted or the literature has quoted that the first time the term psychotherapia was used by English psychiatrist Walter Cooper Dendy in 1853. He was the first one to use the term psychotherapia. Later, Sigmund Freud developed psychoanalysis in treating the neurotic disorders after observing many neurotic patients. He felt that people develop this kind of an illness because of certain thoughts, emotions which they are trying to repress it in the unconscious. So, he felt probably we can treat these disorders if we can allow them to talk about these things, bringing them to the forefront so that we can interpret their narrations and give them an insight as to how and why they are suffering these kind of the disorders. And once the psychoanalysis has developed, there are various versions of it developed by neo-Freudians and later on even by other psychologists. Then the growth of American psychology has led to the emergence of very active and very new psychotherapies which involve the psychotherapeutic processes. The practice of behavioral psychology led to the emergence of various treating procedures for psychological ailments, and especially the concept of behavior modification techniques was the product of this behavioral psychology. Behavior therapy later on was enhanced in order to see that we are trying to emphasize even on the cognitions and also on the emotions of the client. And to understand this and to deal with this, the behavior therapy has been elaborated as behavior cognitive therapy in trying to make the client more effective in understanding his problems and also in dealing with these problems. Then comes the Carl Rogers therapy, the human centered or the person centered or the client centered therapy, where he emphasized on trying to transmit the qualities or we can say the skills like genuineness, unconditional acceptance and empathy for the client, which will facilitate the client to try to understand himself in a more effective way. So, we can say by the late 1960s, over 60 different psychotherapies have been functioning across the globe, ranging from psychodrama to the guided imagery. So, there are number of other psychotherapies too in the form of gestalt, in the form of RET and various other modalities. But more or less the people felt, the clients felt and even the therapists felt that they were time consuming, if not exactly like psychoanalytic procedures, but still most of these therapeutic approaches are taking longer time. And so, this conception of taking the client's time and also the therapist's time led to the emergence of new therapies called brief therapies. Did you hear this term brief therapy? Unfortunately, still they are not very popular, but of recent the brief therapy is trying to gain its own importance among the therapists and also among the clients. And especially when people got the awareness regarding the psychotherapeutic procedures, slowly the importance and the significance and the need of the brief therapies are also emerging. So, we can say today virtually all psychotherapeutic modalities offer some sort of brief therapy designed to help the person deal with psychological problems. So, this is the reason for the emergence of brief therapy. Though there were very popular therapies which were widely prevalent because of the time consuming processes, and as the time is increasing because of the cost involved, both the clients and also the therapists felt the need for a new form of a therapy, and that has emerged in the form of a brief therapy. Now, let us see what is this brief therapy, how many sessions it requires, how the treatment procedures would be involved in this kind of a brief therapy. Brief therapy is virtually an umbrella term for a variety of approaches to psychotherapy. How it differs from the other traditional psychotherapies is, brief therapy emphasizes on a specific problem and also on the direct intervention. In brief therapy, the therapist takes the responsibility for working more proactively in understanding the client's problem, in helping the client treating the clinical and subjective conditions faster than the other psychotherapies. This brief therapy also emphasizes the need for the therapist to be precise, to observe and utilize the existing resources that are available in the client, and also temporarily to suspend the disbelief to consider new perspectives and multiple viewpoints. Those who follow the brief therapy, they feel instead of focusing on analyzing the causes for the distress, that is the historical causes of distress, how it occurred, when it occurred, why it occurred, the primary approach in brief therapy should be to help the client view the present situations in a wider context and utilize more functional understandings. This functional understanding need not be at the conscious level. So, once the client becomes aware of these new understandings, automatically the client will undergo spontaneous and generative changes. Now, let us understand the features of brief therapy. Brief therapy is a highly strategic, exploratory and solution based rather than problem oriented. It is less concerned with how a problem has occurred, how a problem has emerged, rather than with the current factors sustaining it and preventing change. Brief therapists do not adhere to one particular modality as such or one approach as such. There may be number of approaches which the brief therapist can focus upon, but depending upon the client's problem, depending upon the client's personality, they may be using one of the particular approaches rather than strictly following only one approach. In fact, we can say those who practice brief therapy generally use either cognitive approach or behavioral approach or a cognitive behavioral approach. Brief therapy sessions generally last from 1 to 10 sessions, or sometimes it could be just 6 sessions. But the number of sessions was not fixed as such, because the literature indicates sometimes they may go up to 15 sessions in extreme cases. But even under those situations, we can say relatively it is a brief time compared to the traditional psychoanalytic therapies. Among the brief therapies, generally the two approaches, or we can say the brief therapists focus on one of these approaches, that is problem focused approach or solution centered approach. More than the problem focused approach, brief therapists generally try to adhere to the solution centered approach. We can say SFBT, that is solution focused brief therapy. In the solution focused brief therapy, generally there are 4 stages. In the first stage, they try to understand, educate and create the awareness of the problem to the client. In the second stage, they try to develop and implement the goals or the strategies to achieve the goals. The third stage is emphasizing on the positives. That is, as the therapy is going on, they try to understand where and how the client is standing, whether they have to motivate the person So, in order to motivate the person, they try to focus on the positives. And the last one is to make the client rehearse the new skills. Whatever skills were taught in this brief therapy sessions, the therapists try to make the client practice them so that they would be using it in the real life. So, therapists who focus on this solution focused brief therapy, or for that matter even problem focused behavior therapy, they use some of the cognitive behavior therapy techniques like miracle question, you are aware of it, and message technique, and sometimes it could be a scaling technique. So, all these techniques help the client to practice in dealing with the problem in the therapeutic situations, which gives them the confidence, and later on they try to focus in the real life situations. Now, let us understand who are the main proponents of this brief therapy, who started this. If you have to think about the proponents of the brief therapy, it is not just one person. There are a group of people who really developed and also popularized it. But the credit goes to Milton Erickson, as he was considered as a master of brief therapy, and he used clinical hypnosis as a tool in developing this. His approach was popularized by J. Haley in the book Uncommon Therapy, the Psychiatric Techniques of Milton Erickson. The analogy Erickson used is that of a person who wants to change the course of a river. If he opposes the river by trying to block it, what happens? The river would be merely going over him and also around him. But suppose if the client accepts the force of the river and then diverts it in a new direction, then the force of the river will take a new channel, it will cut a new channel. This is the analogy Erickson used in understanding as to how a client should deal with the problem as such. Other than Milton Erickson, another person who really emphasized on the significance of the brief therapy is Richard Bandler. He is the co-founder of Neuro-Linguistic Programming, that is NLP, but he is also a firm proponent of the brief therapy. After studying the Erickson's work for a number of years, he realized, in fact, he mentioned in his book, it is very easy to cure the problem of phobia. Generally, we try to say or we try to deal the problem of phobia for about a couple of years. But after understanding the Milton Erickson's method, he said he has understood that he can cure the problem just in 5 minutes. In 5 minutes, what we try to make the client understand, practice it, and then immediately implement it in the real life, the brain really works as to how we are trying to feed the information into the brain. But unfortunately, what we do in dealing with the phobia is, for 1 week we try to make the client understand, for another week we try to teach him certain things, and later another week. So, it goes on and on, but finally the client comes and says the strategies are not working. So, unlike the traditional methods or approaches, he agreed with Milton Erickson in stating that within the brief sessions, within very few sessions, we can also cure the phobia. Other than these two people, notable therapists associated with brief therapy are Nicholas Cummings, Steve D. Shazer, Paul Watzlawick, Giorgio Nardone. These are the people who tried to elaborate the brief therapy in making the clients understand what it is, why we have to prefer brief therapy to the traditional psychotherapists, and try to popularize the concept among the public. The brief therapies can be conceived as constrained modalities of treatment, but not as episodic forms of long-term therapy. However, in the literature and in the practice, the term brief therapy covers a wide range of sessions and approaches to treatment, varying lengths of time and with variety of goals. Why brief therapy was given significance is, many clients felt that instead of being on a waiting list to get the appointment from the therapist, it is better to seek the brief therapy sessions as it is benefiting them. Wahlberg suggested that all clients who are seeking the brief therapy treatment can really test themselves whether these sessions will be sufficient for them in handling the sessions, or do they really require a longer term therapy sessions. So, when they use this discretion, whether the therapist or the client, whether they have to go for a brief therapy or whether they have to go for a long term therapy, naturally most of the people need not wait for longer therapies if they feel that the problem is not really intense or severe. However, there is an exception to this rule. People suffering with severe mental illnesses and other complications cannot rely only on brief therapy sessions. Now, let us try to understand what characteristics a brief therapist should possess. Irrespective of the approach they follow, any therapist will have the similar characteristics, should have the same characteristics. But however, because the therapy sessions are very brief, they have to possess certain special characteristics, like the first thing is they should be empathetic. Unless they are very empathetic towards the client cannot come out, the client cannot open up with the problem as such. The second characteristic is the therapist should be able to integrate their training with their experience. This training could be from different fields. It need not be confined only to the field of psychology, but any kind of an training which they had as a part of the social work or related to the medical or any other kind of the areas where they have worked earlier, that can be integrated both at the personal level and also at the professional level to create the best therapeutic environment for the client. Another characteristic is to have a sense of drawing personal and professional boundaries, so that the client will not jump onto the therapist beyond a particular line, and at the same time the therapist is also aware where he has to draw a line between the therapist and the client's experiences. Another important characteristic is the therapist should be sensitive to the cultural and spiritual needs of the client, and especially this occurs when they are dealing with a client of a different race, religion or a socio-economic background or any other culture. So, these are the characteristics which one should be aware of to develop before they proceed into the therapeutic environment. Now, once we have understood the characteristics, what should be the goals of the brief therapy? Any therapeutic approach will definitely have the goals, but here the goals play an important role in brief therapy because the sessions are of very short period. So, in the brief therapy, the goals are set by the client after discussing with the therapist. Suppose if the client is not taking any initiative, the therapist definitely plays a vital role in trying to discuss what should be the goals of the brief therapy, and this should occur immediately in the first session itself. Generally, the client will be given a critical role in determining what he is expecting from the therapy, and the therapist try to be very flexible with the goals of the therapy as such. However, suppose like if there is a disagreement between client and the therapist as far as the goal setting is concerned, after the discussion and negotiation with the client, definitely the therapist will adhere to the goals of the client. Another important aspect that is noticed in the brief therapy is if the client has different expectations from the therapy, and if he exhibits or if he concedes the difficulty that he has in trying to commit to the goals that have been accepted, that have been set, or in following the approaches, modalities as part of the treatment procedures, definitely the modifications can be brought about in the whatever has decided earlier, or if the client feels he cannot proceed, a referral can be suggested. Now, about the role of the therapist during the brief therapy sessions. The therapist should work with the client to help him maintain his motivation levels, to identify his problems, and also monitor whether any accomplishments are consistent with the treatment plan and also the client's expectations. Another role the therapist plays is as a reinforcer. When the therapist is reviewing the ongoing process of the therapeutic sessions, if he feels that the client is up to the expectations of the therapeutic sessions, naturally he would try to reinforce it. And he would also observe whether the client is proceeding on to the track or whether he is trying to be away from the track. So, he tries to give the feedback along with the positive and the negative reinforcers. The therapist also remains mentally prepared to identify and also troubleshoot the problems. Some of the problems may suddenly crop up, but the therapist should be balanced enough in order to identify them and also immediately shoot at them. Therapist also maintains an emphasis on the skills, strengths and the resources that the client should update in every particular session. Therapist also maintains a focus on what can be done immediately to change the client's situation or in order to address the client's problem. Sometimes the client may need other services, especially if he is having any physical ailment or any other serious psychological ailment. So, he has to review whether the brief therapy counseling sessions are sufficient or whether he requires any additional services to which the client has to be recommended. Sometimes, if the client shows any reluctance or resistance in attending the sessions or in interacting with the therapist would also focus on any possible reasons of dropping. Either it is because of medical problems or because of severe psychopathology, or is it just a mere treatment non-compliance. Along with these general strategies which the therapist would follow during the brief therapy sessions, he would also develop certain maintenance strategies as part of the treatment design from the beginning. He must continue to provide support, feedback and assistance in setting the realistic goals and also in implementing them, and see that the client's problems are and see that the client is able to get the solutions to the problems. Most of the goals of the brief therapy will be client driven and than those developed in the long term therapies. Now, what is the ending process of these brief therapy sessions? In brief therapy sessions, the termination of the therapy will be planned in advance. In many brief therapeutic sessions, the end of the therapy will have an discussion in which the therapist should leave the client on good terms. That is, he has to inculcate in the client a sense of hope for the change that he would be able to get in, and also to maintain the changes that have already been accomplished. So, here before the therapeutic session ends, the client instills the hope, confidence and the courage in order to inculcate new changes and also to sustain the changes that have been already seen in the during the process. The therapist should also leave the door open for any further consultations in case if the client feels the necessity to come back and discuss with the therapist. So, it is not just like if the termination has taken place, the client should not come over and discuss the problem with the therapist. There is always the door open for them. Then the therapist should also elicit commitment from the client to see that whatever he has learned during the therapeutic process will be followed and whatever goals have been set will be achieved by the client. Before the termination takes place, the review process will be done by the therapist to assess the positive outcomes that the client has expected. Suppose like all the goals were not achieved, or if there are any drawbacks or limitations in adopting certain new strategies, the review will be done on the pitfalls the client might have encountered. It could be about the social situations, it could be about the old friends, relationship issues, or for that matter any other issue that is standing as an obstacle for the client to implement and then practice the skills that the client has learned. The therapist will also review the early indicators of relapses. For example, if the client experiences after a therapeutic session any kind of a depression, the problem may reoccur. Or if the client is going to experience any high levels of stress or bouts of anger, some of his problematic behaviors may come up. So, the review will be done on what could be the possible situations which may bring the relapse of the problem, or any other factors which may hinder the client's motivation to continue his newly learned skills. In brief therapy, issues regarding referral and follow-up are also different compared to the traditional psychotherapies. The reason is, most of the time always the client may not be in contact after the brief therapeutic sessions. So, some information will be given regarding the referrals during the therapeutic sessions itself, and sometimes if the therapist gives importance to the follow-up, that will be taken via electronic mail or over the phone. So, what is the need of the follow-up? In what way it facilitates the further strengthening of the brief therapy? Generally, experts felt after conducting or after reviewing some of the researches on effectiveness of brief therapy that it is advisable for the therapist to follow up with the clients who have completed the brief therapy. This follow-up reassures the client that the therapist is still in touch with the client, is concerned with the client and trying to still help the client in realizing his goals. In addition, this follow-up is also an effective way to gather more data needed to develop the effectiveness of the brief therapy. Suppose if the client was not happy or if the client has not achieved all the goals, the follow-up will indicate the therapist what procedures can be changed or where it went wrong. Naturally, when we focus on the limitations, the effectiveness of the therapy would be enhanced. There were certain studies conducted on the effectiveness of the brief therapy, because many people expressed different opinions regarding the effectiveness of brief therapy. Some therapists or some researchers felt the brief therapy is parallel to any other traditional psychotherapy, though it is short in duration and less expensive, but on the other hand, some opined nothing can be done in very brief sessions or short sessions. So, some studies were analyzed, some studies were conducted to analyze the cases where brief therapy was followed. So, let us see what are those studies, what they are indicating. One such study was taken by Wallace J. Gingerich and Lance T. Peterson. These two people conducted a study on effectiveness of solution focused brief therapy, a systematic qualitative review of controlled outcome studies. So, where the brief therapy is centered around solution focused brief therapy, and whether it was successful or not has been reviewed by these two people. So, what they have done in this study is they have collected all available controlled outcome studies of SFBT, that is solution focused behavior therapy, and tried to evaluate the effectiveness of brief therapy. 43 studies were located. They collected the data regarding the problem, setting, SFBT intervention, design characteristics and also the outcomes. They found 74% of the studies reported significant positive benefit from SFBT. 23% reported positive trends. The strongest evidence of effectiveness came in the treatment of depression for adults, where 4 separate studies which followed SFBT revealed that this brief therapy is comparable to well established alternative treatments. 3 studies examined the length of the treatment and they found SFBT used fewer sessions than alternative therapies. So, what is the conclusion from this study? The studies reviewed provided strong evidence that SFBT is an effective treatment for a wide variety of behavioral and psychological problems, and in addition it may be briefer and also less costly than alternative approaches. Similarly, another study was conducted by Kim Johnny S. He examined the effectiveness of solution focused brief therapy, a meta-analysis. What he has done in this study is, they tried to find out whether solution focused brief therapy emerged positive treatment effects among the clients who have followed this SFBT. Only the magnitude of the effect for internalizing behavioral problems was statistically significant at 0.05 level, thereby indicating that the treatment effect for SFBT group is different than the control group. In a study on family process, some researchers critically reviewed all available controlled outcome studies of SFBT to assess the extent to which SFBT has received empirical support. 5 studies were well controlled and all these studies showed positive outcomes, stating that SFBT is better than any other treatment. And one study revealed SFBT to be comparable to a known intervention, that is interpersonal psychotherapy for depression. Findings from the remaining 10 studies, which were poorly or moderately controlled, they were consistent with the hypothesis of SFBT effectiveness. So, we can say 15 studies provide preliminary support for the efficacy of SFBT, but they do not permit a definitive conclusion. What these researchers felt is to highlight those areas where methodology has to be improved, so that the effectiveness of SFBT can be strengthened. So, we can conclude that brief therapy generally lasts for 6 to 10 sessions and focuses on helping a person to resolve or manage the conflict, the problem that the client is experiencing, and also to bring about a desired change in the life of the client. The therapy is usually solution oriented and sessions are more geared up towards here and now aspects of the problem rather than focusing only on the past or sticking only to the future, though future is also given importance in the brief therapy. Goal setting is the hallmark of this brief therapy, where the therapist is more active in sessions, and along with the discussions with the client and negotiations with the client, the goals will be formed wherein the treatment proceeds more in an effective way.